First, let me be absolutely clear that the Scottish Government remains committed to supporting and empowering the LGBTQI+ community, including trans people. We will continue to build on our work across government to strengthen this. We work closely with the LGBTQI+ stakeholder group and third sector organisations to ensure the voices of those with lived experience helps improve outcomes for these communities. We are also delivering the Non-Binary Equality Action Plan to improve conditions for non-binary community in Scotland, and the plan includes actions already underway, such as meaningfully including non-binary people in decision-making. We remain committed to consulting on an Ending Conversion Practices in Scotland bill for both sexual orientation and gender identity, and detailed proposals for legislative change will be published early in the new year. Conversion practices which aim to change or suppress a person's sexual orientation or gender identity are damaging and destructive acts that violate the human rights of those who undergo them. We remain committed to our work with NHS Scotland to improve access to and delivery of gender identity healthcare. And we are working closely with people with lived experience, organisations representing trans people and NHS Scotland to implement the actions in the 2021 NHS Gender Identity Services Strategic Action Framework. We have established a National Gender Identity Healthcare Reference Group and commissioned a range of work including robust collation and reporting of waiting times, a transgender healthcare knowledge and skills framework with training opportunities for NHS Scotland staff, a programme of research on long-term health outcomes for people who access gender identity healthcare, and the development of national standards for accessing and delivery of gender identity healthcare. This work is well underway. We are also delivering the recommendations of the LGBTI Inclusive Education Working Group. The implementation group has, in partnership with COSLA, promoted effective delivery of LGBT inclusive education in all Scottish schools, engaging with young people to seek their views and experience, and are delivering improved learning environments for all children and young people. And before the end of the parliamentary year, we will bring forward a new human rights bill for Scotland. Let me now turn to the Gender Recognition Reform Bill specifically. The bill's reforms remain the government's policy, and as we can see from the cross-party support for the bill, they remain what this Parliament would like to see enacted. However, the UK Government's intervention means that the bill cannot proceed to royal assent. It remains a bill passed by the majority of this Parliament, and we will not be withdrawing it. There is a strong indication that any divergence of approach would be unacceptable to the UK Government. As Alistair Jack stated in the Westminster Parliament, in short, two different regimes create adverse effects. It is therefore impossible to see how progress can be made, particularly when the rules of this Parliament require that amendments at reconsideration stage are consistent with the Bill's general principles as agreed at stage 1. Nonetheless, our offer is still there. If the current UK Government is willing to work together on this, we will happily sit down with them. If a future UK Government are willing, we will do so with them, so that the Section 35 could be lifted and the bill progresses. It seems clear that the current government will not do this, and it remains to be seen what a future government will do.